remember thinking about becoming a paediatric surgeon when I was training. And I did it. I was an pediatric surgical SHO in Oxford. And I thought, you know what, I might be good enough to do this. Like, this is like, I like pediatrics. I quite like the idea of doing that. And then to cut a sort of longer story short, I remember watching some amazing surgeons do some things. And I remember thinking, I'm not going to be that good. I just knew in my heart I wasn't going to be as good as they were at what they did. And I was like, do you know, that's going to bug me my entire career if I keep on thinking I just don't have that hand-eye coordination or that level.
Are you a doctor who's looking to get into big tech? Well, listen to today's episode featuring Dr. Umang Patel, who is the Chief Clinical Information Officer at Microsoft. So we talked about a range of things, but really focusing on his career journey from pediatrics to big tech at Microsoft via Babylon. Also, how he continues to manage his imposter syndrome. And most importantly, how doctors can position themselves to get into big tech. So don't miss out. And before you listen to this episode, don't forget to subscribe to make sure you don't miss any of our future episodes. And also make sure that you are on our mailing list where we will drop some more really big, interesting tips and advice on your own career journey. So join us at medicfootprints.org/join our mission. Anyway, on to this episode.
So let's get real. Our value as doctors has significantly diminished over the last decade. So how can we turn that around by upskilling and creating rewarding and impactful careers on our own terms? Welcome to Disrupting Doctors' Careers. I'm your host, Dr. Bubbers-Jones, and I'm on a mission to connect 1 million talented doctors with the best in diverse career opportunities.
Welcome to Disrupting Doctors' Careers. And this week we are diving into the world of, as my daughter likes to say, big tech. And introducing a really exciting guest today who I've known for some time, Dr. Umang Patel, who is currently the Chief Clinical Information Officer at, I'm sure some of you have heard of this company, Microsoft. Umang has also worked at other companies, including Aviva and Babylon. And where did he start his journey in medicine? From pediatrics. So we are going to explore how he made that transition and how he's developed his career in the wider world of tech, and most importantly, what that impact looks like. So welcome, Umang.
Great to be here. Thanks for having me.
Yeah, well, thank you so much for your time. And so one of the things we were talking and I was reflecting on before, because I've actually seen quite a few pediatricians who've done really well in tech. I mean, tomorrow we're talking with Satya, who's one of the clinical leaders at Accurx. But tell me, like, why do pediatricians, why do they do well in the world of entrepreneurialism, technology, health tech? Like, what skills do they have that seems to transfer very well, like based on your own experience?
Yeah, I thought this too. I keep on thinking we must set up like a network of pediatricians in health tech and see, because I think it's a great pool of people. In fact, one of the first I met was Claire Lima, who was a pediatrician and went off and had other bits, and she was really inspirational and sort of going off on this alternative career pathway. But to answer the question, I think probably three things. Firstly, we're trained to communicate like more than anything else, and I think that's so important as a transferable skill. If you're a surgeon, you've got lots of transferable skills, but probably your main one, like your hand-eye coordination, doesn't quite translate as easily as into perhaps having meetings or communicating why one thing is better than another. That's not to say that surgeons can't do lots of things, but hopefully you know what I mean. The second one is in pediatrics, you don't really have a choice. You've got to solve the problem. You can't. We're always trained. It's not like anybody, you're always working on behalf of someone else. You're always working collaboratively. You're working alongside parents. So sort of team, working as part of a team and making sure that you get stuff done, again, is a really huge transferable skill. And then the third one is, I think that we spend our entire time looking at people that are holding, pieces of tech or going to be using healthcare or utilizing health services in the future, and that leads you to think like we've got to do something different, right? Like I often remember talking this. This now doesn't stand true because it's so ubiquitous. But way back when, I was like, every single patient that came in, I remember when I was an SHO, just mentally tracking that every single parent had a mobile phone. So, 15 years ago, when people were like, are we, should we or shouldn't we be doing stuff on a mobile phone? If you happen to be doing adult medicine, you might say, well, people might get left behind, or most of my patients might not. Whereas every single person that came through our doors, of course, by definition, was young, not just the patients, but also their parents typically. And they all had mobile phones, which made me think, this is definitely what we need to be leaning into.
I think that's really interesting. Like, would you say that as a pediatrician, I mean, you are dealing with, you've talked about parents in this example, but also children of varying ages, so different approaches at different ages, but also other stakeholders on a multidisciplinary level in a community and hospital setting. So how would you say that experience has translated to the practical work or the current work that you do in stakeholder management in a big tech environment?
Yeah, I think this isn't limited to being a pediatrician. I think being a doctor, being a clinician of all sorts, like that multidisciplinary team. So like, if I think back to Babylon, right? Like you were sat as a small team next to people that were building the app, next to people that were trying to market it, next to people that were trying to convince people to pay money for it, next to people that were running the operations. So being part of an MDT is vital for success. So I think some of the training that we've got, although not necessarily one for one, so your physio is not exactly the same as somebody that a coder, but being able to work with different people is really important. Communicating with those different people and adapting your style to suit them, I think, is vital too. So similarly. And again, it's unfair if I keep on picking on surgeons, but sort of like as a pediatrician, you're often, it's a bit like being like, I'm sure GPs do really well as well in medtech, and so do geriatricians. There's something about you're the coordinator more than the sort of prime event, if that makes sense, right? Like if you're the surgeon, the stuff needs to work around you because you're the thing or the person that's delivering the end result, and people have to work up towards that. Whereas when you're the coordinator or the convener, it's a different skill set that you get to hone. And I think that's really important when you're starting to think about building companies or doing stuff in new ways, like you're often doing in healthcare.
Yeah, I think the communication skills is something that you were taught. The lessons that we learned from comm skill was varied considerably depending on the university you went to. It was taught at various levels. I'm trying to think, what was most important for my experience when it came to communicating at various levels? I think it's what I learned on the job, but also, as you said, like adapting to who you were speaking to. And as you said, that's relevant at, all levels, depending on whether you're a junior doctor or senior doctor. But then how do you translate that to industry? I've found, particularly in industry, that you consciously have to be putting yourself into the other person's shoes in order to build that relationship, to really understand what's important to them. And obviously the difference between working in, say, a public health setting and in an industry setting is the change in what a hierarchy means, for example. So as you know, in public health, it's very hierarchical. In industry or tech settings, not so much. And you're not necessarily, even though you're in a leadership position, you're not necessarily seen as the top dog anymore. Like, how do you manage that in a way? Like, how do you adapt to that?
Yeah, it's a good. Well, I think a couple of ways. Like one is you do have to eat your own ego. So there's something about if you are a senior doctor, there is a general, like if you're running your ward round and you get to tell people to do various other bits and pieces, like it's then very different when you come into something else, and by definition you start behind most people, right? Like you've done another career before you've arrived at this one. So there's a lot of sort of humility that you have to be able to display in order to be able to get on with people and move things through the teams. I think the other way that I always think about doing it is that it's when we talk about this at Microsoft a lot, but we talk a lot about growth mindset as an example. But one of the things that we've got to, one of the things we think about is like, and I always find really fascinating is when I don't know something, isn't it amazing to then think about it? So I'll give you a story. So when I was at Babylon, I remember being in charge of the mental health part of the app that we were thinking about building. So I was like, okay, what we must have if we're going to have this app that's dealing with mental health is we must have this SOS button. We need to have a new button on the home screen that you can click and it will then get you help immediately. So I went to the developer. He was this guy with a ponytail. He was 20 years younger than me. Like just coding away. Had his headphones on. He took them off, and I was like, look, I need this SOS button. He looked at me, didn't say anything, but his headphones back on and carried on going. And I was like, come on, like, I don't mean to pull rank here. Like, I tried again, just to my mind was being really rude. And I said, I don't want to be this guy, but I'm going to go up to our CTO and be like, I don't know what to do. Like, this is what I want. I need an SOS button. I've tried to talk to the team. They're just not listening. And Gary, who's the CTO at the time, he was like, oh no, you've just done the wrong thing, right? What you've done is you've gone to him with a solution. So what he's heard is that you want to put a 7th button on a 6-button screen. That's never going to work. What you needed to do was say, look, I've got this issue. How would you put it in? And, it'll be in a pop-up or whatever else it might be. And it was really, I always remember that story of me being like, I know you're right. And then Gary went, you know what? He'll have way more data than you'll ever have about how if you did put that button on that screen, fewer people would use the entire product. So if our aim, as it was to try and make sure healthcare was available to as many people as possible, like if I'd made that decision and forced it through, we'd have been counter to what we were trying to achieve, even though it turned, he's right? Like Dan had loads of data that could show if you mess up the UX, then, people wouldn't engage with it. So it's really stark for me then to remember that you just don't know what you don't know. But that's sort of the joy of it, right? Like being able to learn new skills and rub alongside people that have those different knowledge bases is really important and a lot of fun.
Yeah, I think that's a great story, and actually a lot of learnings from how I should communicate with our own developers and how they react to certain things. Say, oh, I want something. They're like, no. But that doesn't excuse him not even like acknowledging your request. I have to say.
Yeah, I've hyped it up. It's not fair, and I've used their real names. Which again, I don't know if Dan, if you're listening, then I mean it with love. Although I saw Dan years later, and he'd left and he'd gone and created a game. And I said, and he was talking, we're in the pub, and he was like, oh, we've got some people in the game that get blown up and other bits. And, if you're developing the game, you can base them on different people. And I remember saying to Dan, I was like, Dan, am I one of the people that's blown up in your game? And he just didn't answer. So I took that as a yes.
Awesome. Brilliant. Well, maybe on to one of our next questions. You previously, I think one of the big techs that you started off in was Babylon Health. And then obviously at some point a while ago, you moved on. I mean, obviously at time of recording, we all know what's going on in the news about Babylon Health. And it's really to understand, I mean, Babylon Health, a really exciting company. It's grown massively. It's made such an impact on a global level when it comes to offering primary care at the point of an app. So really bring it out to the millions, contracts with the NHS, et cetera. But obviously that story hasn't ended as well as we would have hoped. But being someone that has been, I guess, again, at senior level working in Babylon Health and having moved on from it, what are your thoughts or advice, I should say, for doctors who at this point in time are thinking, hey, I'd love to join a health tech company, but I'm hugely concerned about what's going on with tech at the moment, the financial risks associated with joining tech, because we know that a lot of startups, or most of 90% plus of startups, do fail. There have been a lot of redundancies going on in big tech at the moment. How would you advise these doctors about how to manage that job risk when moving into health tech companies? But my first question is, like, how does it make you feel at this time, considering what's going on with Babylon Health?
A bit sad. In some ways, like, I love Babylon. I loved everything we did there. When I joined, there were 10 of us, and we grew that company, and I'm incredibly proud of what we achieved. we'll sort of take that to the grave. Like we set out on a mission and we got really close to doing it. The more I reflect on it, it was always slightly inevitable that it was not going to succeed, right? Like at every point in that journey, we shouldn't have been able to do what we did, and we were able to. And again, like I say, really proud of being able to move the needle and set things off in the UK, especially prior to the pandemic, so that we were in a good place for at least telemedicine to be able to be supportive and work during the pandemic. So really proud of that. I remember talking to Ali Parser, the founder, when we were just a few of us in the company, right? So there were 10 of us in the company, and we were having this conversation about what success looked like. And Ali was very much like, I prefer to flame out and like really go for it than just like be mediocre, right? Like it was always, if you're going to do it, do it. Like that's why we went to Rwanda. Like no one else does that. Like, that doesn't
go big or go home, right?
Yeah, exactly that. And I always remember that. And so when I say it was inevitable, that was because that was the drive, right? Like it was never going to be big enough, but it was never going to. We always wanted to do more. Which after when I left because we IPO'd, and I remember thinking, like when does that happen? When do you get to a startup that's gone from a small company into IPO? Like I've got to think about where to go to next. And it just so happened Microsoft called, and they were like, look, you've done something with a company that's got big. Do you want to go to a company that is big and see what it's like? And it was almost too compelling to not have a look. So to watch over the last 18 months to see whilst I've been at Microsoft and see how sort of Babylon has fallen off the cliff has been really sad. But it is what it is, and out of the ashes or out of the things that we've done, I was really pleased to see in Sifted that there were a load of people that were ex Babylon that have got their own startups that are doing really well, and most of those are in healthcare. I think that's a great legacy for the organisation. So that's really my thoughts on Babylon. Like it's a shame, but I don't think that muddies the memories and the achievements that we made.
So I was going to say, so what I can hear from your story is that, again, it's not always about the outcome and the end point, because actually there's a lot that's been learned from that process. There are a lot of opportunities that's been gained from that process, and people that have grown up within the company have also gone out to create their own companies, house startups. Looking at you as an example of someone who has then gone on to another big tech company and doing really amazing things. And so when it comes to translating that narrative to, if you take yourself back to Umang Paediatrician early days, stepping into health tech, how would you advise doctors who do have those concerns about what could happen in that process?
Yeah, what like you absolutely should go into it assuming that it's going to go wrong. Right, like my problem, I went to one startup and it happened to be Babylon. And I remember I joined Babylon because Ali was the best entrepreneur that I'd come across. Like, again, by way of story, I remember like thinking about becoming a pediatric surgeon when I was training. And I was an pediatric surgical SHO in Oxford. And I thought, I might be good enough to do this. Like, this is like, I like pediatrics. I quite like the idea of doing that. And then to cut a sort of longer story short, I remember watching some amazing surgeons do some things. And I remember thinking, I'm not going to be that good. I just knew in my heart I wasn't going to be as good as they were at what they did. And I was like, that's going to bug me my entire career if I keep on thinking I just don't have that hand-eye coordination or that level. Spin forward when I met Ali and so we interacted a few times, there were things that he did and the visions that he set and my entrepreneurial bug. I was like, he's just the best entrepreneur. I would love to learn from him. I'd love to be able to sort of see how he does more. And that's exactly, when I joined, that was what I joined for, not because I thought it was going to become a massive success I joined because I just wanted to see how he did that and just really see if I could learn from it, had any skills that matched up to it. So that was the point. I never expected to last. I never expect, firstly, you don't expect startups to survive very long. Secondarily, like they've got quite high turnover in startups, especially those founded by investment bankers. So you don't. So I would definitely, my counsel would be, don't expect to be there for very long. having said that, you've got a great backup job, but going in with your eyes open is really important. Now, I never gave up practicing, so I still practice as a doctor every Friday at Frimley Park.
How have you managed to maintain that of interest, Umang? I mean, that's really impressive. And that's another thing that doctors are generally concerned about, keeping up the clinical in a meaningful way.
Yeah, again, super lucky. My wife said to me, she's like, "You love being a doctor. Why would you give it up?" And I said, "Well, you have to. Who else can do? Not many people. Nobody does that. You've got to choose one or the other." And she said, "Just ask." And I said, "Okay, I'll ask." And I asked Doug, my boss at Aviva, which was my first job outside. I said, "Doug, can I do a day a week in the hospital?" And Doug said to me, he had a very dry sense of humour. He was like, "I don't care." He's like, if you don't finish your work, I'll fire you. If you can do your work and get it done and spend a day in the hospital, then fine, do it. And that was the beginning of me doing a day a week clinical.
What do your colleagues think of that?
Well, I've done it now. I think about it, like I've done it for like 12 years.
But at the beginning, they were like, "What?"
And it's lovely. Like they describe it as my hobby. I get so much energy from doing it. I really, really enjoy it. And I notice if I hadn't gone and done that, I think it's continuity. I've now got people that were my SHOs that are now the consultants when I'm the middle grade, working as a staff grade on the ward. And it's funny, but it feels very much like a family tribe to go through. But I do enjoy it. I think so. Being able to keep it up. I mean, I'm really lucky. Family have been super supportive. They've been flexible to allow me to work alongside them. I picked Friday for no good reason other than at Aviva it was dress down Friday. And I was like, man, I can't think of what to wear every Friday if I'm going into the office. So I'll just go into the hospital instead. And I always thought, it's always the busiest day. So in some ways, it's quite nice. I know when people come in, they're like, "Oh, it's Friday. Thank heavens you're here." Typically the consultant on the week might be like, "Look, we've had this problem patient. Any chance you can go and have a chat to them or have a think about them with fresh eyes?" Stuff like that, which again gives me a lot of energy and enjoyment, and hopefully adds value back to them.
I mean, would it be safe to say that you actually enjoy pediatrics more now, where you've got that balance between the big tech world and the clinical world?
Like 100%, right? Like I don't think I could. I generally don't think I could do it any other way. So I don't think I could do full time like tech. I wouldn't have survived Babylon without having the energy on a Friday to be like, "Oh, this is why we're doing it. This is why you have to go through all of the ups and downs because it really is important." So like and I notice if I don't go in on the Friday, I noticed quite early on if I for whatever reason had a meeting or didn't do it, I'd lack the energy or the perspective. I think that was a real differentiator as well against being able to deal with the trials and tribulations of a startup and others. You're like, look, it doesn't matter if people are going crazy or doing this or there's high anxiety around this or whatever else it might be. When you then go in on the Friday, you're like, but this is really important to do. So let's just get through it. Like we'll find a way. Let's just knock it down. So I enjoy the Friday helps me enjoy the rest of the week. And equally, I think if I was a clinician the whole time, I think I'd be a bit frustrated, right? Like I still have massive imposter syndrome. So in my head, I still like somebody will call me out and be like, "Hang on a minute, you shouldn't really be here. Go back and just be a pediatrician." And then I'll have to go back and do all of that. But in my head, if I was doing that, I think I'd be frustrated, right? I think I'd be like, well, am I really being able to deliver the maximum impact that I think I can? I think that's a big driver for a lot of clinicians that I talk to that are thinking about, well, what do I do? It's not like, oh, look, I want to be rich or be on the cover of Times magazine. It's about how do I just make sure I can give the most that I can, given that I just really passionately care about trying to help people. And I think having portfolio careers is a great way to do that.
Brilliant. Just moving on to one of our last questions. What would you say are the underserved opportunities available or entry points available to doctors who are looking to get into big tech? And how would you advise that they best position themselves? So, I mean, increasingly so, big tech seems to be out of reach for doctors. Like it's a fantasy of a vision that's like over there. And so, I mean, from your experience as far, what would you advise for doctors who are like, right, I really want to make an impact. I really want to try and get into big tech. How do I position myself? How do I get in? What's the lowest hanging fruit?
A great question. I mean, I'm not sure I can answer what's the lowest hanging fruit. I think and I've said this on a few podcasts, so, but I think it really stands true, is like one of the things we had at Babylon as an example for hiring was what are you going to do that's going to be 10 times the salary that you want? Right. So that was always Ali's question, is like, what are you going to do that's going to deliver 10 times the value of what you want out of it? For me, that forces it into a couple of things. So where clinicians, you're giving something up in order to go on to another route, I think you do have to think about, well, how much of a pay cut am I willing to take, if any, where am I trying to get to? And therefore framing it back in that, okay, well, what can I give back to it? It's really important. And you don't do that in the NHS, right? You don't think, oh, if I do this, because of course it's public sector and the value is assumed as opposed to being measured through a P&L in the same way as a private sector. The other reason for doing that then allows you to go through the thought process of, well, how could I do that? And what am I really good at doing? Broadly, I think that fits into three categories. So you can either build something. So, I build a product, I support the build of a product in order for that thing to then be sold. I sell a thing. So I'm part of the team. So where I sit now, like I sit in I'm going to try and communicate this in a way that people understand it so that then they want it. Or you run the operations of a thing, right? So you go, well, I run the service, I therefore make it less likely to, have problems or be more efficient or, have to pay fines or whatever else it may be. But trying to work through that process of do I, my sort of build, sell, or run, and where's my skill set? Where do I want to be really good? Where do I think I'll have the most impact? Is really important to do with pre-work before you can then start approaching people and be like, oh, I want to do this or do that. So you haven't done that, then you don't know, right? And it becomes really difficult for people to be able to place you or say, okay, great, how can I test that as a theory? So if I take my own experience, like it took me 5 years of thinking about it, and I didn't do this deliberately, but it took me about 5 years before I worked out that I like to communicate and explain things more than I liked, say, doing the governance behind something. And therefore, and like you had to, although that may sound obvious, it's how do you then um, learn those skills? So when I went to Aviva, although my job was more around pathway design and others, I went and joined the sales teams because I was really interested in it, and I thought I quite enjoy these and that. So there's something about once you've got a bit of an idea, trying to get those skill set off the back of it. That takes a lot of time, and you can do that whilst you're working as a clinician versus thinking I've got to go and get that experience at a big tech where it becomes really hard, right?
How did you come to the conclusion? Like, how did you work through that? If you know what I mean. I mean, you said it took you 5 years. Did you have any help, or was that what was your process in actually getting to the point where you actually understood yourself better to then say, hey, why don't I make the most of this part of myself, which I know I really enjoy?
Yeah, well, yeah, it's always easy when you look back. So at the time, you have no idea that you're going through that process. My process was I saw Helen Bevan do a couple of great talks about like what do you want to be when like go and test at dinner parties that you want to be something different and see if you can cope. Work out very much if you want to do clinical work or not. There's great advice about like if you're asking someone, it's the same as you do in medical training. If a patient comes in and is non-specific, it's really hard. If they come in and give you if you come in and go, look, I want to do 4 days a week and I need this and I've got that, then that makes it easier for people to be able to say, okay, I get it. I can say yes or no, or increasingly what people do is they then say, well, this may not be for me, but I might know somebody that might have that requirement, so let me pass you on. So my process was saying yes to any meeting that I could get, and I got very good at an elevator pitch. And my elevator pitch was like I'm Umang, I'm a paediatrician. I really want to be the chief executive of a hospital, but I need more skills in order to be able to do that effectively. And people are like, okay, that's interesting. What skills do you need? Well, I need to have more. I need to learn how to use Excel. I need to know how money flows through systems because I don't know that. They're like, okay, great. That then leads you to, that's how I ended up with the Aviva job, right? Somebody said, well, have you thought about insurance? I know this person, which then led me to emailing Doug, not about a job because they posted a job, and I had massive imposter syndrome. So in my head, I could never have done it. But I emailed and said, look, I don't have an MBA. I don't have any skills. I don't have any of this stuff. But maybe I will have in the future. Can I have a chat to you about just what I might need in order to get this job later? And he said, come and have a chat. And during that conversation, it turned out that I had built some of those skills. And I remember being able to say, oh, actually, I've just seen something that had done something relevant to it, because I'd been at a lecture at the King's Fund that I'd gone to. So I was like, oh, and he was like, oh, yeah, so you do know quite a lot of this stuff. Why don't you apply?
So he helped you to understand that some of your experience that you've gained along that journey actually is something that they would see is of value. Because I know that a lot of doctors actually have that same challenge where they're like, I haven't done an MBA or I haven't done this qualification, therefore I can't possibly be of any value to anyone at this stage. And it's like, hold on a second. I mean, I was speaking to a medical student at a VC event recently, and he was talking about being from a target university, which I didn't really know what that was. But from what I understand, it's like a widening access to university type thing. Anyway, he was like, well, you know, aim for a target university. I don't know how to get into industry. I've got no experience. And I said, hey, you know, wait, hold on a second. You just recently told me that you've run several businesses when you were younger. Do you not think that might be relevant? And he was like, oh yeah, but you know, but a lot of doctors have exactly that same problem, like not thinking outside of what they've done in the scope of being a clinician and everything else, all the extracurricular stuff that they've done, all the stuff that we also had to articulate to get into medical school, right? I mean, you know, the academic isn't everything. It's also everything else that shapes you. My final question, though, is we kind of touched upon it, is about the mindset. So I'd love to hear a little bit more about how your mindset has grown, evolved, changed from, again, being a clinician, the mindset you acquire as a clinician compared to the mindset you need as a CCIO of a big tech company. Like, what are the core differences that you've noticed and seen, especially as you've progressed in your career?
Yeah, well, great question. I think I don't know if they're that different. I mean, it does feel like, you know, you evolve. Having a real desire to do the right thing. I mean, it's lucky I cover Europe, but mainly the NHS. There's something about staying in healthcare. So a key question I think people have to ask themselves is, well, if I am going to leave medicine to go into, am I going to limit it to technology or service, or you know, companies that work in healthcare, right? Like, is it, or am I really, I don't mind what I do, I just want to do something entirely different. I mean, do I want to go and try and use my brain power to help with sustainability? So there's lots you can do that might do that, or are you really wedded to healthcare and so on and so forth? So again, that's a part to think through. So lucky that I've been able to keep that, which has meant my mindset probably hasn't had to change too much. And there's this great, when I was interviewing for Microsoft, I remember they were like, oh, can you like just take us through like examples of your growth mindset, which I hadn't really thought through before. And I just did that thing. I said, well, I really wanted to know, why is it that I didn't know how money worked in the system. So I went to work for an insurance company. That I didn't understand why we couldn't use more technology. So I went to work for a startup. And now I don't understand why Microsoft needs a doctor. So I'm feeling like, you just said, like, you know, it was just, I just really want to
curiosity. Right,
I think that was the main thing.
Because it's interesting, because we held our Doctors in MedTech Roundtable last week, right? So I think we had 7 panelists, the most we've ever had, right, for a roundtable. And one of the really key points that came out of it, because at the moment, LinkedIn and anyone in industry and startup world is talking about skills first hiring. Forget the degrees, you want to know the skills and how that transfers. But actually, you had the Anushka Pacheva from Wellix, you had Charlotte Lee Sinclair, commercial director at Limbic, both saying, actually, we don't hire for skills, because that has also led to some really bad hires. We hire now for curiosity. So we want someone who is genuinely motivated, interested, committed to our values and what we're doing, because we know that translates to really great outcomes, productivity and growth. You talked about growth mindset. And so what you've described is really interesting, because you were just genuinely really keen and interested, right? To find out more.
I was like, I didn't think I'd get the job. I was like, I just want to know why. Like, it was, and I think that's
like, why.
I think that's true of most clinicians, right? You're just trying to, and then I think we get lost in our heads a bit. So to answer your question about, you know, people are, well, I don't have the skills for this. Do I need to do an MBA? Do I need a qualification? And I you know, in my experience, you don't, but you do need to, you know, have that ability to get your energy from a place that will keep you going. So my point about the 5 years was not so much that I actually realized it took 5 years, but I didn't feel like that. It was just I knew I wanted to do something different and I wanted to find out these things, and you have to keep on going. And I remember vividly being at the King's Fund, listening to the lecture that I talked about, and sitting in the far left corner, hoping that nobody would talk to me because I was so intimidated by all of these people that I thought were way more senior than me. And um, but I had to. I remember forcing myself to go to it because I wanted to listen to the topic, even though I didn't know anyone else there in the other bits. And clearly, you get to brush over the bits and present it as a great story. But like I remember thinking, and I met actually Rahul Chadari, who's another paediatrician that's doing some great stuff in Wolf Centre in the NHS England. And I remember him saying to me, "Oh, I remember seeing you at one of those lectures and having a really brief chat." So however many years later, it's lovely to have thought some of that stuff connected. So it is worth doing when you can.
Absolutely. Well, thank you so much, Umang, for sharing your experiences, your journeys, and the imposter syndrome came out quite a lot. I noticed in this conversation. It's interesting because I every single person I talk to, including myself, it's not something that goes away. Yes, the confidence does build, but even some of the most inverted commas most senior people I see, they still get it. They still have imposter syndrome. Like, how much do I really know? I don't know why everyone thinks I do know it. But anyway, thank you so much for your time. I'm sure you'll continue to do amazing things. And obviously, if anyone wants to find out more about Umang, he's also available on LinkedIn. Any final words?
No, great. Please do come and say hello to me via LinkedIn. Like I'm always trying to get more LinkedIn followers. And like it's been great chatting, and I look forward to speaking again soon.
Awesome. Thanks a lot, Umang. Take care.
Thanks.